Good evening to all. The 25th research theme that we'll be focusing today is a quick glance at the medical management of patients with stable coronary artery disease. So we have this two directional flows. One is an angina relief. How is that done? So as a first line, we tend to provide them with short-acting nitrates. In addition to that, we may give even beta blockers, right, in order to reduce the heart rate. And if beta blockers are not available, maybe even calcium channel blockers could also be used. At the same time, uh, if the heart rate is sort of lesser, or there's an intolerance, or maybe a contraindication, consider calcium channel blockers with, instead of that, you can go for dihydroxypyridine. Otherwise, if the angina is greater than the level 2, so you can go with beta blockers plus calcium channel blockers and the dihydropyridine. So the Canadian Cardiovascular Society, uh, according to this particular research, uh, presents another second line method, that is, you can add or switch to the primary line by providing long acting nitrates like and various other drugs that are given. So, but at the same time, prevention is better than cure, as I always say. So if you need to prevent, of course, lifestyle management and definitely controlling the risk factors would be one of the uh, major methods. So, of course, this can be provided with aspirin, statins, and even angiochromatic enzyme inhibitors, right? So on and so forth. So this is what we generally, according to research, they consider for an antidote. If all these are not successful, then you consider an angio, that is a PCI stenting, or even a coronary artery bypass graft. So, indications for revascularization of stable CAD patients on optimal medical therapy is when patients with unprotected left main or 2 to 3 vessel disease with other comorbidities like diabetes mellitus. And if their left main arteries, there's a stenosis of more than 50% of diameter, or even if there's any proximal LAD, which is again stenosed with greater than 50% diameter, or 2 to 3 vessel disease with that is single or triple vessel disease with impaired left ventricular function, or single vessel with more than 50% diameter being stenosed. So these are the indications and